In this video we will talk about classes, regimens, administration of insulin, and side effects of insulin. Classes of insulin. Insulin is categorized based on how quickly it starts working, when it peaks, and how long it lasts. The main classes include rapid-acting insulin, short-acting insulin, regular, intermediate-acting insulin, long-acting insulin, premixed insulin. Let's talk about them one by one. Rapid-acting insulin. Examples: insulin Lispro, insulin Aspart, insulin glulicine. Onset: 10 to 30 minutes. Peak: 1 to 2 hours. Duration: 3 to 5 hours. Use: taken just before or right after meals to control post-meal blood sugar spikes. Short-acting insulin. Examples: regular insulin, soluble insulin. Onset: 30 to 60 minutes. Peak: 2 to 4 hours. Duration: up to 12 hours. Use: often used 30 minutes before meals. Intermediate-acting insulin. Examples: NPH insulin, which also call as isophane. Onset: 1 to 2 hours. Peak: 4 to 12 hours. Duration: 12 to 18 hours. Use: covers blood sugar between meals and overnight. Often combined with short-acting insulin. Long-acting insulin. Examples: insulin glargine, insulin detemir. Onset: 1 to 2 hours. There is no peak. Duration: up to 24 hours. Use: provides a steady insulin level throughout the day and night. Insulin degludec is an ultra-long-acting insulin. It works up to 42 hours. Premixed insulin. Examples: Humulin 70/30, Novolog Mix 70/30. Contains a combination of intermediate and short-acting insulin. For an example, in mixed insulin, there are 70% isophane and 30% soluble insulin. Use: taken before meals to cover immediate and extended needs in one injection. Diabetic patients in home commonly use premixed insulin. Next, we will talk about insulin regimens. If you have diabetes and need insulin, your doctor will choose a regimen, or schedule, that fits your needs. Think of it as a plan for when and how much insulin you take to control your blood sugar. Here are the most common types, explained simply. First one. Bolus insulin regimen. A bolus insulin regimen refers specifically to short-acting or rapid-acting insulin taken at meal times to manage the rise in blood glucose after eating. Second one. Basal insulin regimen. A basal insulin regimen involves the use of long-acting insulin to maintain stable blood glucose levels throughout the day and night, especially between meals and overnight. It's often called the background insulin. Third one. Basal bolus insulin regimen. This regimen uses two types of insulin. Basal insulin provides steady, background insulin throughout the day and night to manage fasting blood glucose. Bolus insulin, short-acting, or rapid-acting insulin taken before meals to manage post-meal, prandial, blood glucose spikes. Fourth one is sliding scale insulin, used mostly in hospitals. This depends on blood sugar readings. Short-acting insulin, given only when sugar is high. The higher the blood sugar, the more insulin is given. Short-acting or rapid-acting insulin is usually used. This method does not account for carbohydrate intake, physical activity, or basal insulin needs. Mainly used in hospital settings. Short-term management of blood glucose. Patients who are acutely ill, post-operative, or not eating regularly. Not ideal for Long-term diabetes management. And not ideal for type 1 diabetes, due to risk of ketoacidosis. Now let's talk about administration of insulin injection. Insulin must be injected subcutaneously, under the skin, to work effectively, as it would be broken down in the digestive tract if taken orally. Proper technique is crucial for accurate dosing, preventing discomfort, and avoiding complications like lipodystrophy. Injection sites. Insulin is injected into the subcutaneous fat layer, not muscle. Sites: abdomen, thighs, upper arms, buttocks. Abdomen. Fastest absorption, avoid area 2 inches around the navel. Thigh. Slower absorption, good for long-acting insulin. Upper arm. Moderate absorption, may need help reaching the area. Buttocks. Slowest absorption, less common site. Important tips. Rotate sites within the same region, for example, different spots on abdomen. Always use a new syringe or pen needle each time. Never share insulin pens or syringes. Store unopened insulin in the refrigerator, 2 to 8 degrees Celsius. Do not inject into areas with bruises, scars, lipohypertrophy, infection. Side effects of insulin. While insulin is essential for managing diabetes, it can cause side effects, especially if not used correctly. 1. Hypoglycemia, low blood sugar. Most common side effect. Symptoms: shaking, sweating, confusion, dizziness, hunger, irritability. Causes: too much insulin, missed meals, excessive exercise. 2. Weight gain. Insulin promotes fat storage and increased appetite. Common in patients starting insulin therapy. 3. Injection site reactions. Symptoms: redness, swelling, or itching. Repeated use of the same site can cause lipodystrophy, lumps, or indentations. 4. Allergic reactions. Rare but can occur. Symptoms range from mild, rash, to severe, anaphylaxis. 5. Edema, fluid retention. Swelling in hands, feet, or ankles may occur after starting insulin. 6. Insulin resistance. Over time, some people may require higher doses due to decreased sensitivity to insulin. Here are some tips for insulin use. Rotate injection sites to prevent lipodystrophy. Store insulin properly, refrigerated until opened. Use insulin within recommended time frame after opening. Check expiration dates. Work with a healthcare provider to adjust insulin doses based on diet, activity, and glucose levels. Monitor blood glucose regularly to avoid hypoglycemia. Carry fast-acting sugar, like glucose tablets, in case of low blood sugar. So, that's everything you need to know about insulin. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health education content. Thanks for watching, stay healthy, stay informed.